everyone. I hope you are going to be able to join me. Jackie asked me to come in so that I can talk to you about some of the risks that we're seeing, some increased risks. We are seeing a large increase in calls to the National Suicide Prevention Lifeline. And I also believe that crisis text line has started seeing an increase as well. So just want to make sure, ask any questions in the chat box and I will try and answer them. I know some of the things that are really important right now, hey Danielle, is to make sure, like when I do a telehealth session, I print out the demographic sheets. I use Simple Practice. So I print out the demographic sheet with the client's contact information, their emergency contact information, and any other information that I might need, whether it be their insurance or whatever, to have right there with me. And then I just keep it with me. So if there is an emergency right then and there, you have their emergency contact information and you have their phone number. Let's say you get disconnected or something. You have their phone number that you can actually call them right back and you're not having to start to scramble for it. Because as we know, the internet is not always reliable. So we want to make sure that we, have access for that. I also let them know that in the beginning. So, hey, Jackie, my pleasure. I'm happy to be here. I let them know that in the beginning that I do have that, and I confirm with them that that is the best number to contact them on if we do get disconnected via video, especially if you're seeing a client who is at higher risk or who has anxiety and their anxiety has increased. You want to make sure that they feel as comfortable as possible being able to talk to you, whether it be, on the computer, on the phone. Some people prefer phone versus, video. So that's okay to do too. The other thing is I know that Jackie was saying that there are questions about determining risk and, can you see a client via telehealth if they are high risk or suicidal? So the answer is yes and no. It really depends upon your client and it really depends upon, the comfortability level that you have. Seeing your client on video is wonderful because you can see their facial expressions. You can actually see what's going on. If you're on the telephone, it's a little harder. You could hear voice intonation sometimes, or if there's, like a pause, you're going to have to be more interactive. But doing it via video and telehealth this way, yes, certainly. If you're going to ask them the same questions. You're going to want to know, if you go to my website, which is NoreenVanderhoeven.com, I will put that on later. I have a free download of the Brown and Stanley safety plan, which is really used globally. And that's the safety plan that you should be using. It asks, kind of what are their triggers, what are their internal coping skills, what are their external, so like internal, what can they do by themselves without having to, go to anybody, whatever it is, whether it be coloring or meditating or taking a drink of water. A gazillion coping skills, right? And then who are their people that they can contact if they're having a crisis. So you want to make sure that you know all these things. I would definitely also have that out with you every session, is their safety plan. So you can refer to that with them. I do a safety plan with every client so that way, and I don't deem it a suicide, for like suicidal ideation. I deem it a safety plan as so if you're having anxiety and your symptoms are increasing, these are things that you can look at to see what you can do right then and there. Because when you're in crisis or when you're anxious or depressed, it's hard to think of those things right off the top of your head, as simple as they may be. So that's number one. So that download is there. But you need to ask them, where are you? I use a 1 to 5 scale. 1 being no thoughts of suicide, 5 being that you are going to follow through, you have a plan, you have intent, and you are going to kill yourself today. And you need to be able to ask them very directly and specifically. So in the course that I teach, which I will put the link up to after, it's good for 6 CEs, I talk about you don't want to ask gentle, kind of roundabout questions that, it's so important to be able to ask those direct questions, because if you're asking a direct question of, are you feeling like you want to end your life or you want to kill yourself today? That's very pointed and direct. They're either going to tell you yes or no. Maybe they're going to say maybe, I don't know, and then you can explore that with them. But if you ask them, oh, you know, and I've had this happen to me, like in pre-op, I had back surgery, and so pre-op, they were asking, oh, you know, do you feel like you want to harm yourself? And so I kind of gently and kindly asked her, are you asking me if I want to kill myself? And she said yes. And people just are afraid to ask. So some people think they'll put the thought in someone's head. Some people think that it just sounds so harsh. And yeah, it does sound harsh, but it's serious. It's someone's life you're talking about. So you want to be very direct. If you're asking about harming, maybe you're asking about like non-suicidal self-injury. Maybe someone does want to harm themselves, but they don't want to kill themselves. And, you know, so you need to be clear about that. When you ask that, if you're on video, you're certainly going to be able to see their reaction. So that is just so important, you know. The other thing is in determining risk, that's how you determine is, you know, where are they? Are they saying that no, they cannot keep themselves safe and that they need someone to be with them all the time in order to be able to keep themselves safe? Or are they still going to try and attempt something? Or are they just having some thoughts because things are just so horrible for them right now that they are just really struggling? And yeah, they wish that they would be dead. They wish they wouldn't have to live through this. They wish they can go to sleep and never wake up again. And they do not have a plan nor intent of doing it, but that's how overwhelming things are for them. So that's how, you know, you, like in a quick nutshell, because obviously it's a much longer process, but that's how you can, you know, determine risk right there. And, you know, every state is different as far as their laws. Every state is different as far as how police respond to a house, you know, if you call 911. So the one thing that I would really encourage you to do is go onto your website of your governing body. So like for me, it's the Board of Behavioral Sciences, you know, the BBS. So find out, you know, what are their governing rules around that as far as, you know, ethically and legally. And if you have to, call your police department and ask them, you know, at what point do you respond if I have a client that's suicidal? Or who do I call? Is there a crisis team? Like for our county, we have a crisis team. I am in a relatively, I don't want to say small county, because compared to other counties in, you know, the United States, our county is big. But our county, Ventura County, is smaller than Los Angeles County. And so our crisis team is a 24/7 mobile response team. And if you call them and they deem that you're a danger to yourself, they will come out no matter where you are, no matter what time it is, and they will provide an emergency mental health assessment. And they'll decide if you, or if it's your client, you know, well, I mean, you know what I'm saying? Like your client could call on their own. Anybody could call this crisis number. So if you're calling for your client, they'll come to your office, or if your client's calling and they're in an alleyway somewhere, they'll go there, and then they'll determine if they can engage in a safety plan and be able to de-escalate the client, or if they need to place them on a 72-hour hold to keep them safe. And really, that is a last resort. We really, really try to see what it is we can do to put things in place to keep the person in their environment, because there's so much more of a chance of success for that person in moving forward than when they go to a psychiatric hospital. That could be very, you know, demoralizing, dehumanizing. The people in the lived experience field, which is people who have attempted and survived suicide, they talk about that all the time, that, you know, their preference is not to be locked up in a hospital, and that they just wish that, you know, people would be able to help them differently or knew how to help them differently. So the more, I always say, like, knowledge is power. The more knowledge you have, the better it is. I think, you know, the other thing is really knowing your client. I kind of said that in the beginning a bit, but, you know, some clients are chronically depressed and they chronically have suicidal thoughts, but they're not going to act on them. But maybe because this is such a different circumstance and they're isolated so much, that that's one of the things that is increasing the risk, is, you know, the isolation in all of this. So I would be working every session with, your clients on what is it that, like, what, I was just asked this yesterday, like, what's the silver lining in all of this? If there's anything, pick like one thing. So I have a client who their spouse lost their job because of what's going on. And, they said their silver lining is that they get to have their kids home because their kids are usually in college and grown. So that was a silver lining for them. Try and find one thing. The other thing is, I always talk about with my clients is, as bad as things are, there are always things that we can be grateful for. So pick one thing every day, set an intention in the morning, really stay present in the moment. These are things, that I'm talking with them about, and find just one thing that you're grateful for. Whether it is you're grateful that you were able to get out of bed today. Some people, that's really hard to do. So maybe they can say they're grateful for that, or they're grateful that they were even be able just to step outside to get some fresh air. In normal times, like, these aren't things that we would even think of, but now it really opens up so many more things within the realm of thinking about these things, of what we truly are grateful for. We are grateful that we're still living today. We're grateful that we didn't, catch the, COVID-19 virus and are really sick with it. So really try and help them focus on the things that they're grateful for. That will always, it's not a cure-all, and it's not something that's going to, instantly go, oh yeah, I'm not suicidal or I'm not depressed. But all these little things add up. So the more things that you can do for that, the better. What I'm seeing is my clients are having a lot of anxiety about what's going to happen, in 2 weeks or in a month or in 6 months. And kind of what I tell them is, every day right now is different. So the only thing that we have control over is today, and I kind of explain, like, in here, in this little circle, this is them in this little circle. They can control them. This is contained. They cannot control anything that's outside of here. So to look for outside of all these things are the things that are going to make them anxious. So they need to look at what they can control today. So today they can control what they're going to make for lunch, or what they're going to make for dinner, or if they made their bed. So all these little things is have them focus on right now. I wouldn't even have them focus on an hour from now if that's too anxiety provoking for them. For some people, it brings comfort to know that they will be able to prepare their next meal. For some people, it's too anxiety provoking. So again, your clients. I will put in the chat box, and I know that Jackie is also going to post. There is the link to my course. My course is for 6 CEs, and I discounted my course 80% right now. So right now my course is only $129, and it's a suicide risk assessment course. In California in particular, we need 6 CEs by 2021 to either renew or to get a new license through Board of Behavioral Sciences. Other states have different requirements, but really, regardless of what your requirements are or not, this is such important information. And I've had seasoned therapists, who've been practicing for years, call me and ask me questions, and they've taken my course and they've said they've learned so much. But I don't think that you can ever learn enough. I always say the day I stop learning is the day I need to leave the field. So I wanted to make this affordable enough, and it has all the downloads. It has intake assessments, like a full-on intake assessment from the time the mom was pregnant all the way until now. Very detailed. And then it has a separate suicide risk assessment. And it talks about all the different types of assessments as well. I have, a really narrative-based assessment that goes really detailed and asks a lot of questions. I talk about how, to work with coping skills, risk, what the difference between risk and warning signs. Some people don't know that. And then a big piece, which is the last piece, is vicarious trauma and self-compassion, and how that affects us. Because especially today, if we're not taking care of ourselves and we are not allowing ourselves that space, we're not going to be able to take care of others. everyone always uses, the oxygen mask. And I always say that if you cannot, if your pitcher is empty, your bank in here is empty, you can't fill someone else's cup. You can't fill any cup. So you really need to be able to, take the time. I know for me, what I've been doing with telehealth, I hear a lot of people say that it's just so exhausting, is the two things that have really helped is I've got that blue light reduction screen for my computer. For the first 2 weeks, I had a headache every single night I went home. And for the last, couple of days, I've had no headache, which has been amazing. And the other thing is I try to not schedule more than 2 clients back to back, whereas normally I could see 5 or 6 clients back to back. Now 2 is my maximum. And then I take a half-hour break and I just go outside my office. I take a walk. I'm like in an open courtyard building, so I'm really fortunate. Or I just take some space. I get away from my computer, but you really need to be able to allow yourself that space, and that will also help you. So if you guys have any questions, I'll be checking back here throughout the day. So feel free to drop your questions in. You can also email me, info@vanderhoevanassociates.com. I will put that in the chat box too, because that is a mouthful. And yeah, I look forward to it. I'm glad that I was able to do this, and I hope that this was helpful for you guys. And please take care of yourself and have a great day. Bye-bye.